Vanessa. Hello and welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. We're here at the beautiful Biltmore Hotel celebrating our annual Health Symposium and Health Champion Awards. And with me is Dr. Vanessa Villacorta and also Sebastian Ramirez. They're from One Medical, and I'm so happy to have them here today. And Dr. Villacorta, what an honor. I read your bio, and I was expecting to see as a doctor with so many accolades and your resume is so impressive, an older lady, and I see here a beautiful woman who had a baby while she was doing her residency. So that just in and of itself speaks volumes of the committed individual and doctor and professional that you are. So tell me a little bit about yourself and how you started and now what you're doing.
Great, sounds good. Well, thank you very much. First of all, it's an honor to be here with you all, and we really appreciate this recognition. I think that the recognition to be innovators really belongs to One Medical. I just have been really blessed to be part of this organization and be introduced to One Medical about a year and a half ago, and I have been absolutely beyond impressed with, number one, the quality of human-centered, compassionate care that we provide, not only for the patients. We are obviously very patient-centered, but for the first time, I'm really experiencing the same compassion and the same human-centeredness towards the medical providers and towards the staff. And I can tell you, in the 15 years that I've been out since training, that this is the first time that I really feel like my organization really cares about me as much as we care for the patient. And that really translates into really compassionate patient care.
And I like what you're saying, because back in January, I got pneumonia, and when you say about compassion care and the quality of care and the personal touch, I didn't receive that. And as a result thereof, I changed my primary care because I called. I was seen in an urgent care, and they told me he can't see you until 3 weeks from now, virtual. And I said, virtual for pneumonia?
Right.
You would think that they would take more, but then immediately after the call is quality control. Were you questions answered properly? You know, that little thing that all big companies do. Where you did? I said yes. You were very nice. Besides the fact that you were not able to help me, nor the doctor gave me an appointment. So when you mentioned this compassion care is so important, because patients nowadays are just left like that. Oh, there's no appointment. 3 months from now, by that time, either you heal or you die. Yeah. Right?
Absolutely.
And Sebastian, tell me a little bit about you and what you do.
Perfect. Well, thank you, Lily.
Of course.
I'm in charge of business relationships here in Miami market, a small, medium business size. And I help businesses providing employees with the access of this fabulous idea of primary care, right? We call it like that because we allow people to connect with primary care doctors the same day or the next day when they need it, so in our locations. So face-to-face with a doctor within minutes.
And what is one medical business, is it?
It's One Medical for Business.
One Medical for Business. Tell me a little about that.
So One Medical for Business, basically, we reinvented the membership of primary care to allow businesses to provide not only the employees, if not their families too, access to this method of primary care, right? Okay. So you can enroll One Medical in two different ways, individual or business-wise, right? The business-wise is not only for one individual person, it is for the entire family itself. And that's something that we can talk with other businesses to put it as part of a benefit package, because at the end of the day, it's nothing better than having healthier employees,
and the partnership with UHealth, Vanessa?
Yes.
Dr. Vanessa.
No, please. Actually, that's one of the things that makes us different. At One Medical, we offer a very relaxed, warm atmosphere. Our clinics look beautiful. We actually don't go by doctor. We introduce ourselves by first name.
That's very beautiful.
We don't have medical assistants. I actually go right out to the lobby, all the way to where you're sitting in your couch, in your beautiful couch. Oh, and I say, hi, Lily, how are you? I'm going to take care of you today. And I actually stay with you throughout the entire visit. And that's a 30-minute visit, which is another different. Talk about burnout. I was really feeling the pressure of the 15 to 10-minute visits that many other places have.
Yes.
We don't do that. We do 30-minute appointments. We don't double book. So the appointment is really safe for you and no one else.
It's that personal touch.
And the doctors and the medical providers stay with the patient the entire time, from beginning to end. So that's something very unique. We don't wear white coats because, again, we want us to just have that comfortable conversation.
Yeah, people get nervous when they see the white coat. And the blood pressure.
Right. Yeah, and we take the blood pressure. And so there's no white coat hypertension. Excuse me. No, I'm just kidding. It is real. But the partnership with the University of Miami is just a big bonus.
Oh, yes, UHealth. They are amazing.
They are so amazing, and they really allow us to obtain, stay up to date with the latest medical evidence-based medicine. We have access to expedited specialty care. So when we exhaust our, our skills as primary care physicians, we can manage many things from weight loss to hypertension to diabetes, asthma, allergies, ADHD, depression, anxiety. All those things are bread and butter for us.
I love
but
it.
when we get to the point where we say, okay, I need my specialty friend, right, for a
Right,
friend.
exactly.
We have the great partnership where they can actually
with your health.
expedite. Sometimes it's really hard to get into the best neurologist in
Your
town,
health
to the
is-
best
is a
cardiologist.
university, exactly.
That's right.
It's part of the University of Miami. We have the best doctors. Yes, we
so
do.
that
we
partnership's
do.
it's really wonderful for
wonderful.
that reason. They also come and speak to our providers on a regular basis and give us clinical rounds so that we stay again up to date.
Oh,
And we
that's
also have
amazing.
a team
Wonderful.
at UHealth Connect, the scheduling department, to expedite our own patients'
patients.
specialty appointments.
So this is
So
the
you
best,
really get
the
in
best
faster.
relationship.
It really is,
And
the
this
best
is the
of both
best
worlds.
for the community. So I
Absolutely.
congratulate you. You're receiving an award
Thank
today.
you.
You're going
Thank
to
you.
be a panelist. Today we're going to be talking about mental health. But then,
wonderful.
yes, it's going to be very interesting. And I thank you
Great.
so much for your
Thank you.
valuable time. And Dr. Vanessa Villacorta and Sebastian,
Thank you
thank you
so
so
much,
much,
Lily.
both
Appreciate
of you. And thank you to One Medical. And I love what you're doing together with UHealth and everything that you give back to the community. This is really giving back. What you are doing, One Medical, is really giving back to the community by giving your time, by removing the white coat, by
Yes.
going to the lobby to greet the patient. That is just a completely different experience. It's so innovative, and I congratulate both of you.
Thank you
and
so
the
much.
leadership.
Thank
And
you.
we'll see you all next week at the same time. And thank you for tuning in to another episode of A Business Minute with Lily Lopez.